what drew you to pediatric dentistry?
Well, of course I like kids, but it's more than that. My parents, my grandparents, I think they inspired me to get where I am. Um, they were all strong believers in education. My mom's a teacher. My dad's a general dentist. Um, and my dad would work in a nursing home. And his patients would say, your father's the best dentist I ever had, which is something that stuck with me. And it's something that, I wanted to have too. I want to be one of those people that makes a difference in their community, was an essential part of it. That's what drove me to dentistry. And then as for pediatrics, it's really a great way to get on the ground floor, to start educating and start initiating healthy habits at an early age. No one should be afraid of the dentist, but unfortunately, most people are. At least 70% are afraid of the dentist. And it's even more so for kids. But my goal is to provide a positive experience, to educate, so no one develops that fear. So that's why I'm a pediatric dentist.
So what was your journey like to becoming a dentist?
It was long and it was arduous for sure. After college, I went to graduate school. I didn't go the traditional route. I got my master's in public health, which I really enjoyed. I really enjoyed doing that. And before that, I studied molecular biology in college. And then I took a big turn to study public health management and policy. But I'm happy I did that. It sort of changed my perspective. I have a sort of a different perspective when I sort of treat people. Then after that, I went to dental school, which was, I hate to say it, it's traumatizing in a lot of ways. I had nightmares after I graduated for a couple of years. Those luckily had to have stopped. But the first 2 years of dental school are really tough. A lot of people don't realize that, because we do the same thing as medical students do. But on top of that, the first few years, we learn how to we learn dental anatomy. We learn how to do fillings, crowns, and dentures. And so it's a lot, and it's a lot to pack into 4 years. A lot of pressure, a lot of stress. But I'm happy I'm done with that. And then afterward, there's residency. I did 1 year at Brooklyn Hospital, doing general practice residency, and then after that, I went to NYU and Bellevue for my pediatric residency.
So how would you describe a typical day in your life? It could be pre-COVID, now.
Well, my role is still the same. It's just sort of pre and post COVID, or during the COVID. The only difference is really the amount of patients we're seeing and the way we're delivering treatment. There's more PPE. We're all wearing N95 masks. We're wearing gowns. We always wear gloves. We always wear masks, but not N95. We're wearing face shields or caps over our head. So it's the day-to-day, it's changed a little bit, but overall it's pretty much the same. I have two major roles in the department. The first one is to teach and to supervise the dental residents. They spend about 1 year with us in the general dentistry program. And my goal there is to make them feel comfortable about doing pediatric dentistry, because there's over 150,000 general dentists in the U.S. and only about 8,000 pediatric dentists. And there's just way too many children for us to take care of. So we need the general dentists out there to fulfill that need and to fulfill that gap. My second role at the hospital is to treat children in the operating room. Unfortunately, the population we serve at Brooklyn Hospital has a very high prevalence of severe early childhood caries. A lot of these children can't be treated in the traditional clinical setting. So we take them to the operating room, and I'm happy to provide that service. It's one of the things I like about being a pediatric dentist.
Would you say that's the most rewarding thing about your career?
Something I enjoy. When I see a patient change, whether it's improvement in their oral health, their oral hygiene, they come in and they don't have any new cavities, or they're no longer scared of seeing the dentist. That's really what I hope to see, because I see a physical change or observable change. One of the greatest moments I had was actually at Brooklyn Hospital when I first started. It was one of my first OR cases. There was a boy about 6 years old. He was on the autism spectrum and he was nonverbal. After we took him to the OR and came back for a follow-up a week or so later, his mother told me he started speaking again. And I'm not saying it's a cure or anything like that, but it was a big change, and it also shows that our oral health is important and it's connected to the rest of our body. So that was a big moment. It hasn't happened since, but it's usually smaller things that.
So what would you say is the most challenging part about your job?
Challenging is, to be honest, the parents. It's usually the stubborn parents. Not all parents are like this, but typically some parents will refuse the treatment you recommend, or they don't want to change their habits. You see them coming in with bottles of juice, and childhood caries used to be called baby bottle syndrome for that exact reason. It's because people feed their children juice and they get decay pretty severely. And that's the most frustrating thing, because these bad habits and these bad experiences that they're having at the dentist could be prevented, and they're also going to perpetuate them throughout their life. So that's something that's very frustrating, but it's something that I've had to deal with. And a lot of the ideas that people have, they assume that baby teeth are going to fall out, that we don't have to worry about them, but it's not true. It's important for their development of the permanent teeth. It's important for child self-esteem. If you're missing a tooth, that's going to affect your self-esteem. Any tooth can have pain in it. And in the worst cases, it's even cause death.
Oh, wow. I didn't know that.
Yeah.
But is there a way that you have like a game plan to resolve challenges like these, or is it sort of just like a day-to-day, case-by-case basis?
Well, everyone's a little bit different, so I want to treat everyone as an individual. But all I can do is educate them. A lot of people get the wrong information. If you Google something, you'll get the bad information or the more controversial information first, and you won't get the whole story. So all I can do is educate them, hope they listen, and hope for the best. But also, I can't really take it with me. I can't take it home. I don't make it personal. No matter what, we're all entitled to make our own health decisions. My role isn't to make them make the right decision, but to inform them and to educate them and hope that they make the right decision. And that's something I try to teach the residents every year. We try to do what's right, but it's really up to the patient ultimately.
If you could share one thing about being a dentist to others, like the general public, someone like me who, doesn't know, what would it be?
Well, I think as a whole, we're misunderstood. Like I said before, people think that baby teeth are just going to fall out. They're not that important. Why take care of them? Why go see the dentist? And people think, we're just sort of like used car salesmen. We just want to make money, but that's not the truth. It's actually a lot of work. We don't make as much money as we used to in the past. Dental school tuition has gone way up, and insurance we pay a lot less every year. It's not easy, and on top of that, something I discovered after dental school was it's emotionally draining. It's what you do every day is you give bad news, because people have cavities, they have gum disease. So disappointing people all day, every day is something it's hard to deal with. So I don't want people to hate us. I don't want people to think, we're just out to take their money or anything like that. What we have to say is important, and we don't just say it to say it. We have your best interest at heart.
So how do you strike a work-life balance when, work can get personal in that sense?
Well, like you said, is the work life balance. So whatever balances your work life. For me, it's going to the gym, it's working out. Sometimes it's going to see a movie, just not thinking about things, just relaxing. But you have to have that balance. And people who don't have that balance, they see get burnt out or they get stressed out. And it's best not to take things home with you. Don't take things personal. Just do what's right. And at the end of the day, you got to take care of yourself as well.
Do you have like one favorite go-to snack on the clock?
It's funny you ask that because I usually don't snack, especially now that I'm diabetic, because that means like another shot of insulin usually if it has carbs in it. So I usually don't. I definitely snack less now. But before my diabetes, if someone brought in a box of donuts into the office, you better believe I'm having a donut or two. Donuts, I would say, are my guilty pleasure.
That's not a bad guilty pleasure to have. So is there anything else you'd like to share about COVID, about diabetes, about dentistry?
A lot of people don't know what we do, like I said, but I'd like to let parents know, future parents know that baby teeth are important. Pediatric dentistry wouldn't be a specialty in dentistry if it wasn't important. Tooth decay, people don't know that it's the most common chronic disease in childhood. It's actually 5 times more common than asthma, which is number 2. However, unlike asthma and type 1 diabetes, it's 100% preventable. Okay, so please do your child a favor. Please have them see a dentist by the time they're 1 year old, and that you should set them up for a lifetime of happy dental visits.